with the physicians that are participating with Forest Park in each community. The mix of physicians is unique, the services provided is unique. It's tailored to the needs of the physician and medical community in each city. Each facility is stunning. They look like five-star hotels. They're beautiful. The physicians now have an opportunity to take their patients to a facility that focuses on quality care and quality outcomes for their patients in a beautiful setting.
Martha has a question for Dr. Peter Fisher. Why would a person come see you after a post-massive weight loss surgery?
I believe that someone like myself who really super specializes in post-massive weight loss body contouring is able to give these patients the results they're looking for. I've been in practice for 25 years. For the past 15 years, I've specialized in post-massive weight loss body contouring. I believe that these patients can and deserve to get excellent results for themselves after their massive weight loss.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine, Forest Park Medical Center.
It would take all day to talk about telemedicine, but I can talk about my aspect of it, which is using the power of the internet and computer-aided communication to treat patients at long distance. My cancer patients, once they have their pumps in, need to be refilled. And for many of them, especially if they live a long way, we've had patients as far away as Uvalde, Texas. One of my patients actually took a trip to the coast on distances, in that case, of thousands of miles. In the past, they would never be able to do that. They would have to come to the office and get their pumps refilled. And that's a burden for them and for their family members who have to bring them. But now we have a service where nurses can go to their house and refill their pumps. One would think that I would lose contact with them, but what we can do is they can set up a laptop computer and sometimes even a smartphone, and I can actually see my patients, speak to them in real time if they have concerns about their pump site, swelling of their ankles, even disability. I actually had one nurse put my patient through a neurological examination on the screen while I watched. With that, I can diagnose problems from a distance. This gives people much better quality of life. It saves time, money, expense, and for many of them, pain due to the long travel they would have to make to see me. Telemedicine extends our reach. I guess it could be around the world, but for the most part, we've kept it here in the United States. You know, this man who went to the coast, he couldn't travel because if I gave him a handwritten prescription for his pain medicine, he can't take a prescription from Texas and get it filled in Florida. But I can send an order to a nurse in Florida and she can go fill his pump. And even change the medicine, which is what we did, to get him back on the road. With telemedicine, you no longer live too far away from me to be your doctor. Today, I can manage problems, from a distance with this service. And so people who thought that it was too far to come to San Antonio can come once, we can get things set up, arrange their care, and manage them as if we were right around the corner.
Dried plums or prunes are packed with polyphenols, a plant chemical that has been shown to boost bone density by stimulating your bone-building cells.
Barbecue and Blessing. It's our community event, and we're so excited to have reached this milestone in San Antonio. We have Chamber of Commerce weather today. It is absolutely gorgeous. We have the Chamber here to do our ribbon cutting with us. We also have the Dallas Cowboy cheerleaders here, Rowdy's here as well. Just a lot of activity and press as we kick off this facility in San Antonio.
Well, we're so happy to be here, opening our 4th Forest Park facility and introducing the wonderful service that we like to provide to the city of San Antonio. I can't describe how proud I am of what we've been able to accomplish with all of our physician investors all over the state who have faith in what we have talked to them about and have faith in what we're trying to do.
The whole premise behind Forest Park is we're going to do surgery differently than everyone else. We're going to treat patients differently. We're going to have outcomes that reflect a higher quality of care. When we look at robotics, what Da Vinci provides is the ability to, with a minimally invasive fashion, to go in and operate on a patient. So instead of making a large incision in a patient, we're able to do it through small incisions that are placed throughout the patient's abdomen. So if I have a smaller incision, I can have maybe less post-operative pain or less blood loss throughout the surgery. It's much more accommodating to know that at the end of the day, I didn't leave with a large scar. I didn't leave with the associated pain and post-operative complications of having that.
We are always so excited to be a part of these openings, and this is probably one of the best ribbon cuttings that we've ever been to with the chamber. This is awesome. The facility is gorgeous, and everybody should come out and have a chance to take a look at this because they should be very, very proud of what's in their community.
We're really excited to be a part of this. This is our 5th development for Forest Park so far. It's really a special day for us to be able to invite everybody into our house, to show them all of the work that we've been putting in place over the last year and a half, to show them all of the finishes, all of the art, all of the furniture, to tour them through. They can really get excited about it now and see the reality of those renderings that they saw years ago. Now they're resurrected into what they can walk through and touch today.
We are so excited about opening day. We are ready to go. We've been positioning and preparing this facility for over 2.5 years. And with our over 100 physician partners and over 450 credentialing physicians here, the sky's the limit. We are so excited to raise the level of care in San Antonio.
Forest Park Medical Center is a physician-owned hospital that is committed to providing personalized patient care in an environment that employs the most current advances in healthcare. Now up next, we're going to take a look at what some San Antonio physicians are saying about Forest Park Medical Center.
Before we even start the surgery on the patient, we actually review the plan. The 3D analysis that was obtained from the CAT scan allows us to see the knee in real time. And this allows us to see the orientation, the alignment, and actually the size of the implant that we'll use. So I can actually look with 3D technology to see exactly what the implant looks like, the alignment, the rotation. As we get into the surgery, I can actually make adjustments in surgery to balance the ligaments inside of the knee as well. So once we place these pins into the bone, we attach what we call arrays to the pins. And this allows us to consistently always know the position of the bones at all times. Once we register both the patient's anatomy and register the robot, then the next step is to actually begin the surgery itself. So I can slowly chisel away the bone that's necessary. When I look at the screen, the green data tells me the extra bone that I must remove. What's critical is this robot will not allow me to go outside of the plan that we've instituted in the very beginning of surgery. The surgeon is actually still doing the surgery. The robot is just allowing the surgeon to do it in a more precise manner because the robot will not let me deviate from the plan at hand. Then the next step is to trial or place the implant to see if it fits correctly. And as you can see, it's perfectly aligned, the rotation is perfect, and as a surgeon, it's very exciting to see that we can do this reproducibly, consistently, and do it successfully. This technology allows us to do surgery with the smallest incisions possible. Our patients are recovering much quicker than the traditional approaches.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center.
Dry cough is a very common problem that affects a lot of people, and sometimes it even interferes with their sleep, and it may lead to urine incontinence. A cough is not a disease, but it's a symptom of an ongoing disease. Things that can cause a dry cough are reflux, postnasal drip either from allergies or from chronic sinus infections, bronchitis, asthma, and sometimes even medications. For example, when you're taking ACE inhibitors, which are medicines for blood pressure, like enalapril and lisinopril, you might have a cough from these. So discontinuing these medications will usually resolve the cough within the next 2 weeks. Allergies are one of the most common conditions that will lead to cough, and patients usually experience postnasal drip. Sometimes they'll also notice itchy eyes or itchy throat. Treating it with an antihistamine and with anti-inflammatories like nasal steroids will help to reduce the cough. In other patients, the cause of the cough could be what we call silent reflux or LPR. As opposed to patients that have the common reflux, what these patients experience is no heartburn at all, but they may have this chronic dry cough. This is usually treated with medications that reduce the acid. Cough can also be a sign of a serious illness. For example, chronic bronchitis, pulmonary emphysema. It could also be lung cancer. So make sure that you talk to your doctor if you've had a cough that's lasted more than 3 months.
Best Docs Network is your source to finding the right doctor. By clicking on San Antonio under the Our Doctors tab, there you could browse through all the different specialties, check out the profile pages, and watch more educational videos. Dr. Kathleen Hands is a thyroid specialist and endocrinologist here in the San Antonio area. Now let's tune in as Dr. Hands discusses pregnancy and thyroid disease.
My husband and I were trying to have a baby, and we tried for 9.5 years. So we had infertility issues, and it was recommended to me finally to go to a fertility specialist, which I did. And when they did all my lab work, they noticed that my TSH and T4 were down really low. And so they said I had to go to an endocrinologist before I could start any more process of doing IVF. So my doctor recommended Dr. Hands to me and said that I needed to come see her, and she could look at my thyroid and see what I needed to do.
For patients who have underlying thyroid disease, that first trimester is the most important. So always make sure that you let your physician know as soon as you're pregnant that you have thyroid disease, because your dosing needs to be adjusted immediately, and that is going to help for safe, normal outcomes in a pregnancy.
She came with a diagnosis that I had hypothyroidism and Hashimoto disease, which sounds scarier than it is, but it's just you have to have thyroid medicine to bring up your thyroid. In order to be able to get pregnant, I had to have that fixed, which she did. So I went on common thyroid medicine, and I was on it for, I think, 2.5 months, and it brought my level up. And then I was able to do IVF, in which now I'm pregnant, so it worked.
So knowing that you have underlying thyroid disease, we'd like to make sure that everything goes well for those patients. And typically we have wonderful, perfect outcomes for those babies if they're treated appropriately during pregnancy.
Meeting Dr. Hands, it's definitely changed my life. If I hadn't come to her and had my thyroid checked, looked at everything, I would never be in this position. We would never have, be able to have our little girl. And so I don't think there's any other endocrinologists out that are like her that really takes a real personal interest into your life. And it's incredible. It's really, really nice to have somebody that you know looks out for you like that.
Today, Forest Park is delivering toys that our employees have collected to the Salvation Army. This is something that we participate in every year, and it's something that we do as a way to serve those in our community that we, throughout the year are serving, but this is our way just to give back during the holidays.
Today we have our shared services holiday luncheon, and it's just a fun time to get everyone together. We have a tacky sweater contest and food provided, and just a time to hang out with all your other coworkers.
Forest Park culture is geared toward a sense of community. You really feel a sense of belonging. You feel that you are a part of an important system, which it really is. And everyone exudes a sense of pride. Everyone that you see is smiling. Everyone has a very good attitude and feeling towards Forest Park. It's palpable, you feel it everywhere.
Working for an organization like Forest Park, you feel like you're serving the community every day, and there's, throughout the year, always opportunities to give back, and they really keep you plugged in and aware of those opportunities. So while this time of the year we're certainly giving back by giving toys to the less fortunate, there's always opportunities at Forest Park to give back, and it makes it just a great place to work, and you really do feel like you are a part of something bigger.
Forest Park is very generous with their employees. They offer us a lot of holiday events, and we had a Thanksgiving event, and they also give us the time to spend with our families. They have an excellent PTO plan.
Because Forest Park is very generous with their PTO plan, it allows me as a father to spend time with my kids and my family. The people here are genuinely really nice. It struck me the first day that I started. When I would walk around, people would smile, say good morning, how are you? There's just a different feeling, a type of hospital at Forest Park.
Cardiology is a medical specialty that deals with disorders of the heart. Dr. Juan Martinez is a cardiologist here in the San Antonio area. Now let's meet the doctor.
My principles in patient care involve trying to treat every aspect of the patient. So that includes all the way from their family members, their loved ones, to treating and helping the patient as well. For me, obviously, it starts with, for example, someone comes in with a heart attack. You treat their heart attack, you treat the most emergent problem. We start from doing the procedures and immediately stabilizing the patient, and that moves on to education for the patient. There's a variety of different things that you're going to see with heart attacks that don't just include saving that heart tissue and helping them live longer through medicines. It's going to include lifestyle changes, it's going to include exercise, and I try to remind them that they can lead a normal life. They can lead a just regular length of duration of life expectancy.
If you or anyone that you know are interested in rhinoplasty, then this next segment is for you. Dr. Jose Barrera is an otolaryngologist and facial plastic surgeon here in San Antonio. Now up next, Dr. Barrera will be discussing rhinoplasty with one of his patients.
I wasn't very confident. I wasn't very outgoing, and that's something that kind of started back in high school when my face really started to change. I think one of the main things was that I would feel very, very uncomfortable when someone would look at me from the side. And so then that's when I suggested to my parents that I was considering a rhinoplasty. I guess it's a family nose. I had a very large hump on the bridge of the nose. When I would look straight ahead, you could kind of tell it shifted towards the right. My first consultation with Dr. Barrera, I was really nervous because I wasn't really sure what to expect. He was very approachable, he was nice. We decided to go with the rhinoplasty. Dr. Barrera was very specific on what he was going to do on me. All the work he was going to do was basically going to be inside, so that kind of put me at ease.
We often see patients who present for rhinoplasty for many reasons. Some patients come in because they have a functional problem, they can't breathe, they have a twisted nose or a crooked nose, and so we aim to straighten the nose. And many patients come in for aesthetic rhinoplasty. You want the nose to look great, to be very aesthetic. If it's a female, you want a very feminine nose. If it's a male, you want to preserve some of the masculine characteristics of the nose. At the same time, most people prefer a very straight profile. Now, the recovery for rhinoplasty surgery is pretty expedient. Patients wear a cast for about a week and then the cast is removed.
This procedure has not only changed my life physically, but emotionally as well. I'm more confident. I feel like when someone asks me a question, I don't have to turn and look at them like that. I don't want anyone to see me from like the side. Dr. Barrera, I think he is an amazing plastic surgeon. He's very kind, he is approachable, and I think the fact that he specializes specifically in the face makes the patient feel more comfortable. He's definitely the person to go to, especially if you're wondering what fits best for you.
That's our goal, is to achieve very harmonious, aesthetic rhinoplasties that still function and breathe well.
Forest Park Medical Centers have a completely different insight to patient care and delivery of service. In the 26 years I've been a RN and a medical director or a nursing director, I've had a lot of opportunity to deliver great service, but never been given the resources or had the mindset within the facility to really extend that 5-star treatment and service to our clientele, and that's what brings it to Forest Park. If you're in healthcare and don't have high patient outcomes, good quality, there's no reason to be in healthcare. Patients deserve the best treatment they can get, and they deserve the best outcomes we can give them. Not only are we going to give great customer service, we're going to give great clinical treatment, we're going to work as a team, we're going to be a happy family, we're going to accomplish great things here in San Antonio. The ICU and the inpatient arenas are designed in a way that are aesthetically pleasing to our clientele. We overcome a lot of the obstacles that you would find in a normal hospital or acute care setting. We've designed the facility to actually implement and accentuate the care and the service that we're giving. 5-star treatment, 5-star service in a 5-star setting.
Bobby has a question for Dr. LeRoy Jones. After a penile implant, how does it look and feel?
After the penile implant, it looks and feels like a normal erection. Patients are able to still have a normal orgasm and ejaculate if they still have their prostate, and so they're very happy with it.
Thank you everyone for joining us this morning on another episode of Best Docs Network featuring Forest Park Medical Center, your destination to better health. Now, if you're still curious about this hospital or you're ready to request an appointment with any of the doctors you've seen on today's show, just head to our website, bestdocsnetwork.com. Got any questions or comments? Please feel free to email us at info@bestdocsnetwork.com. So long, everyone, and we'll see you next week.